This is a kind of a complicated slide, but if you look at the green surrounding triangles, these are all the things you need to do to improve your health. Digestion, nutrients, thyroid, adrenal, taking care of your life structure, making sure you get adequate activity, your environment, healthy foods, good food choices, and as you notice in the bottom corner, hormones. And that's why this presentation today is actually an important part of the philosophy that we hold in terms of helping you figure out what you need to do for yourself through the help of professionals to make those better choices that help you improve the quality of life, the quantity of life as well, we hope. It doesn't come across as yellow, but the kind of yellow-green triangles, they're yellow on my screen, are the reduce. These are what I call the dysregulators. They're what throw us out of whack. Toxins, emotions, toxic emotions, focal infections, chronic infections that you don't know you have that's smoldering in your body, candida yeast overgrowth, excess, and one of the big excesses is sugar, but it can be any kind of excess in your life, can throw you off. Stress can really dysregulate what's going on in your life. And the central triangle, red, is inflammation. Inflammation is actually meant to be our protector, our friend, but what happens when we become dysregulated, what happens is that our friend starts to become I wouldn't call inflammation our enemy, but it's at the basis of just about every modern disease you can think of. If any of you can think of a modern disease that does not involve inflammation, let me know. Because almost every disease that we know of has a component of dysregulated inflammation. But once you get things back into balance, your inflammatory system is good. It helps protect us against infections, and it helps heal up our injuries and our wounds. So it can actually be a good thing, but we have to make sure these surrounding issues are well regulated in order to achieve that high level of good self-care. So these are what we call the 7 correctable causes of illness. And so today we're going to look at the whole question of hormones and how that might fit into that kind of big picture. And so the question is, for the lecture, are bioidentical hormones safe? And I have in my slide the picture of a kind of androgynous human being there. And you can see all the various glands, and the hormonal glands are crucial. Our hormonal system is crucial in terms of regulating the important systems within the body. This is just a little bio of me in terms of my journey, and I've been here 26 years now. I've been a physician now, whatever that is, 30, I don't know, too many years. Can't even keep track of it. Our objectives are to understand how hormones act as naturally occurring molecules that regulate all the important processes within the body. And as I've been here, I've keep asking the question, what's happening to people? Why are people having health issues? What is disease? And more often than not, disease is dysregulation. It's where the normal regulatory processes in the body have gone amok. They're not doing their job. We're not able to maintain our health. And for what appears to be mysterious reasons, we have problems and illnesses and cancers and infections and moods and all kinds of things that happen to us, and they appear like they're happening out of thin air. They're really not. And the real challenge of being a doctor here and working with patients here is the work of detective, working as a kind of Sherlock Holmes of health with patients as co-detectives, because really your insights into what's going on in your life and how choices you've made impact your health is crucial, because once you have those insights, then you can make the changes that will help you achieve the results that you're looking for. So we're going to be focusing not on all hormones. I mean, I have tremendous interest in thyroid, adrenal, the pituitary. You know, there's some very important hormones and organs that we need to have working for us in order to be healthy. But what we're going to focus on today is the sex hormones. Their changing role in women and men as we age and experience the change, because we do change as we age, and many of us experience it in different ways. Some people seem to just kind of breeze right through the change, and other people seem to have a great deal of trouble with the changes that's going on in their body. And we want to see if we can understand why and what can be done in a safe way to help facilitate that change, or those changes, so that we don't change as fast. I mean, we would rather just try to stay as young as possible, at least to function as young as we can. We can't change the calendar, but we can change the rate of biological age. And I know all of you are aware of friends and family members who don't look their age, either one way or the other. Some people don't look their age in the bad direction. They look a lot older than what they are. When you find out what they are, you say, "What? You're that old?" But then we have people who obviously look a lot younger than their calendar age. And that's where we think hormones do play a role in that, and nutrition and all the things that I just put up there. And then this is also an opportunity for me to talk a little bit about orthomolecular health. And the word orthomolecular always gives people a little bit of a twist. What does that really mean? And we'll try to go into that. But these principles of orthomolecular health can help guide us in the proper use of what we'll be defining as bioidentical hormones, and how these can be safely used to replace the hormones that we're losing as we age. So the Wikipedia defines a hormone as an impetus. It's a molecule released by a cell or a gland or an organ in one part of the body that affects and regulates cells in other parts of the organism. So hormones are right at the heart of regulation. And so if health is self-regulation, you want to make sure your hormones are all tuned very nicely. Generally, only a small amount of hormone is required to alter cell metabolism. It doesn't take much. And in essence, it's a chemical messenger that transports a signal from one cell to another. You can almost think of hormones as leaders. They're kind of like they lead the cells. You know, we have a very complex multi-organ body that we live within. And in order for it to function smoothly, it has to have a good communication system. You could compare it to a team or a business. And oftentimes it's the communication that occurs between the parts that gives rise to what would like in a symphony, the difference between music and noise is, first of all, how well are the instruments tuned, and how good of a conductor do you have? How well are the various components orchestrated? And so hormones orchestrate the normal functioning of the human body. And I don't know how much I'm going to get into this in the lecture, but there is a tremendous amount of disruption going on in our bodies these days because of environmental toxins. Plastics, for instance. Plastics act like estrogens. They call them xenoestrogens. Pesticides, DDT, acts like a false estrogen. Plus, there's a lot of synthetic estrogens that are in our food. It was of interest to me to be talking to a gentleman who we were talking about testosterone replacement therapy, and I mentioned to him how estrogen seems to be a big problem for men these days. There's a YouTube video called "The Disappearing Male," and it's how so many men are struggling with their testosterone levels And we think partly it's because of these xenoestrogens that are in the environment, and also because so much estrogen is being used in the feedlots. And he said, "You're darn right, there's a lot of estrogen being used." I said, "Oh, really?" He said, "Yeah, that's my business. I raise cattle. In the last 10 years, we've been using 5 to 10 times the amount of estrogens than we used to use." So and that does, estrogen in excess can actually fatten up the cows. And so then we wonder why our culture is becoming overweight. Part of it's because we're getting these false signals that are disrupting the normal endocrine balance, the normal signals that help orchestrate the body parts. That's some very significant environmental challenges. Part of what this lecture is actually kind of if you have trouble following me, or if you kind of want to review what I'm saying, we did do our Health Hunter newsletter on this very lecture, and so some of these same points will be in the newsletter. I don't know if we handed that out. Yeah, okay, good. But part of what I talk about in the early part of that is how when we're young, how many of us ever really even thought about our hormones? I mean, who ever worried about hormones when you're 14, 16, 18, maybe some acne, maybe you were a little bit overzealous. That's an understatement. In life, they call that hormone storm, when you're that age. And we do know that puberty is occurring earlier. Menarche is occurring much earlier in young ladies, and some guys are having more trouble with their testosterone levels, and part of it is this whole estrogen discussion. But in general, most adolescents don't really think a lot about hormones, and we certainly don't worry about the safety of hormones. I certainly didn't think of, and it's not even really considered a problem. We don't really worry about an adolescent boy getting prostate cancer. Very few adolescent girls come up with breast cancer because they have too much estrogen, or boys have too much testosterone. So it's kind of a funny thing, how suddenly this, which we associate with a very vibrant time in our lives and associated with growth and vitality and enthusiasm for life, hormones are really a wonderful thing. And yet all of a sudden when we start to get old and the hormone levels may be dropping, and we start thinking about putting some replacement hormones in, like, oh no, be careful, these could be really dangerous. So there is a kind of disconnect in our thinking about hormones. And so part of what we're doing today is exploring why is that and what might be a factor in all of this. And so this is what I was talking about, the signs of healthy maturation. I mean, just think of maybe not all of us had a great adolescent period in our lives, but for the most part, we remember that time. I remember that time as being a time of energy and strength and athleticism and beauty. And our minds were curious and alert and creative, and we were really out there. I remember there was a time when I thought I was going to change the world and fix the world. I don't know if I think that anymore. Now I'm kind of working one person at a time, mostly on myself. I figure if I can do a halfway decent job there, I've accomplished something. But signs of healthy maturation, these are what we associate with youth. And youth is associated with an abundance of well-regulated hormones. And as Mark Twain said, it's such a shame that the folly of youth is so wasted on the young, and how many of us would like to have that back again. And yet there is a kind of inherent promise, or at least possibility, that if we did use bioidentical hormones, maybe we could get some of that back. So, yeah, and this is my question. Did any of you ever even think about hormonal safety when you were young adolescents? Probably not. It's more of a question for in recent times, and I'm going to try to point out why hormonal safety has become such a big question in our minds, especially as those of you approach the age that you think maybe I'm curious about using hormones, but I'm kind of worried about it at the same time. We want to approach them, but yet we're afraid of them. The medical profession itself throws up a lot of red flags concerning this. Here's my rendition for male menopause. It's kind of sad, and yet it does happen. That's hormonal. Those are hormonal shifts. Certainly dietary factors enter into it, but diet and hormones, there's a lot that could be said about diet and hormones, and I won't have time to really go into that today. Exercise, but that whole delta that I showed earlier, this, unfortunately, I don't think this fellow has done a great job in terms of taking care of himself. He may have thought he has. He may have been doing the best he could. But one of the intriguing questions that I have patients ask themselves is, what can I do better today? How can I take better care of myself right now? And when you start asking that question every day, you have the opportunity to avoid some of the changes that we normally associate with aging. I do not think aging in the way that sometimes we portray aging as a terrible thing, and the golden years aren't so golden for a lot of people. And we look around at the rising incidence of diabetes and obesity and chronic illness in our culture. I don't think it has to be that way, but I do think people have to become more invested in their own self-care. That's my big message these days, that true healthcare reform is self-care reform. And this gentleman would probably use a little extra self-care reform. And the problem is, too, is we'll have people come in at the late stage of what's been going on with them. And I kind of think it's like a retirement fund. You know, the day you retire at age, whatever, 65 or 67, and you say, okay, now I'm going to start my retirement fund. Most financial planners will tell you, you know, it's kind of late. You really should have thought of that years back. Now, I don't think there's ever a time that it's not a good idea to start taking better care of yourself. It doesn't matter how old you are. And I do have some like 90-year-old patients that come in and say, okay, now I have some time finally now, let's work on my health. So, and we will. And because there's there's never a time when you can't do something to improve your health. It doesn't matter what the situation is. But for abundant, exuberant, youthful health, I think you have to start a little younger, hopefully, than this fellow did. So we're talking a little bit, just in this first few slides here, about male testosterone levels. And testosterone does a lot of really good things for men. It's a wonderful hormone. It's not just a sex hormone. This is one of the interesting things that we have to kind of change our thinking about, is that sex hormones are not about sex. I mean, yes, they are to a certain extent, but they're really about muscular health. They're about bone health, brain health, heart health, glycemic health, keeping your blood sugar regulated better, preventing a number of diseases like macular degeneration. I believe that good testosterone levels can help prevent prostate cancer. I know it's true. There's good research that if you have advanced prostate cancer and you take a testosterone blocker, yes, your prostate cancer will slow down. And you can even stop the progression of the prostate cancer by taking testosterone blockers. Does that mean that testosterone, though, is the cause of prostate cancer? See, that's where we get mixed up. We think if we block something and we get an effect on a disease, that somehow that meant that that hormone caused the disease. I think that's incorrect thinking. Testosterone does a lot of things to promote good health, but again, it has to be used properly, and that's what we're talking about today. How do you safely use these hormones in a way that helps you achieve better health and better functioning? The same goes for estrogen. And by the way, men and women both have estrogen and testosterone. Obviously, women have more estrogen and less testosterone, and men have more testosterone and less estrogen. But those ratios are important, and actually we do measure them. One of the interesting things in men, just a kind of an interesting point, the most common plastic surgery done today is what in men? Not facial surgery, breast reduction. So men who have excessive body fat or are using alcohol excessively and their liver detoxification enzymes are not working too well, or they're deficient in zinc, or they have an overabundance of these estrogens in their body, they will start to take their, normally around adolescence, the ratio of testosterone to estrogen in young guys, adolescents, is about 50-1. Middle-aged men, it's about 25-1. A lot of the guys that I see that are starting to feel like they're getting old and not in such great shape, 10-1 or 5-1. And I have seen guys that actually have more estrogen than they have testosterone, and they're the ones that are getting the moobs, the male boobs, or the excess, the loss of hair, body hair, the change in just their whole way of how they think and feel. So estrogen out of balance in men is not what we're looking for, but there is a certain amount of estrogen that all men do carry. Now in women, estrogen provides femininity. It's very important in terms of memory and mood. There's this, I should have gotten this cartoon. I think I can tell it to you, where this lady's who obviously is in menopause and not on any estrogen, she's sitting up in bed and she's shaking her husband. She says, dear, wake up. She says, I just remembered something that you did that irritated the hell out of me. And so, but the whole question of Alzheimer's is a very serious one in that, and that there's a very strong connection between being on estrogen, and having better memory and less likelihood of developing the Alzheimer's or the memory problems. It helps prevent, all the symptoms of menopause. It's very important in terms of vaginal health, not only in terms of vaginal atrophy and thinning, but also the weakening of those structures such that you can develop a cystocele, where the bladder kind of falls into the vaginal area, and you tend to get into bladder infections. Having normal quality sleep, estrogen is important. Preventing heart disease, preventing osteoporosis, preventing colon cancer, preventing macular degeneration, healthy skin, hair, and nails. So all of these things are really good things about estrogen. And women who are going through menopause, or through their puberty, and you can see a young girl they can just blossom into a beautiful flower, and that's estrogen and the right balance with progesterone in terms of the female cycle, and a little bit of testosterone. Too much testosterone, what do you get? You get acne, and a lot of women who are having acne, of adult acne, they're actually having an imbalance in their estrogen testosterone. It's kind of an opposite type of problem, where their cells are much overly responsive to androgens or testosterones in their body. So we can see that estrogen has a number of different target tissues. So as you take the estrogen, it works throughout the body, the brain, the autonomic nervous system, the heart, the bones, the urogenital area, the skin. All of these things without estrogen age more rapidly. A lot of women say, well, I went through the change and I didn't need any estrogen, I don't want any estrogen. Probably those women are the ones that they have a very good adrenal system, they can convert, even though their ovaries have stopped making estrogen, their adrenals now can make estrone, which is the female menopausal estrogen. It's not quite as strong as estradiol, but it can still work, and some women do that very well. Other women don't, and they have a really tough time. And so menopause can be a very tough time for some women. Other women, it's not such a big deal. I wanted to just throw this slide in here. Dr. Jonathan Wright was commenting on this, that the Chinese invented hormone replacement therapy back in the Middle Ages, that they had the young people, they would collect their urine. Then they'd put them out in trays in the sun, and the crystals that were left were incorporated into youth remedies. Does your green tea taste funny today? But those were a lot of your hormones are excreted in the urine, and so that was the first use of hormone replacement therapy. So it's not anything new. Hopefully we've refined it quite a bit better than that, but that's an illustration of how that was used back then. So I'm going to there's a lot that we could talk about in terms of hormones, but let's talk about why we even consider hormones not to be safe, and why most doctors, you start talking about hormones, there are some doctors who don't even want to talk about it. No hormones. Major red flags. And it really, it all kind of stems from this one study that started back in 1993, and I think it was really being publicized in the early part of 2000. I can remember being at a summer vacation and reading, it was big headline news that, estrogen, hormone replacement therapy is dangerous, and this was a major change in thinking. And so this was the National Institute of Health study, the Women's Health Initiative, sometimes called WHI. 27,000 women were put into this study, and they had to terminate it early because 2.5% of the enrollees started coming up with heart attacks and breast cancer. And this was a shock. This represented a major change in the standard of care. And this is, I think, one of the major reasons why nowadays there's a tremendous amount of ambivalence regarding hormone safety because of this study. And if you look at the slides here, coronary heart disease, strokes, breast cancer, the combination hormone replacement therapy, those are the blue lines, and the placebo group, those are the yellow lines. And so you can see that there was, in 10,000 women, there was these increases in heart disease, heart attacks, strokes, and breast cancer. There were some benefits, though. These were venous thrombosis episodes. There was still some reduction in colorectal cancer, hip fractures. There was not a change in the total number of deaths. So there was not a mortality change. It was just the incidence of these conditions went up. And so based upon this, the study was dramatically stopped. And of course, any kind of news like this just gets really, it's in the newspaper big time, health news. But I want to kind of go through three variables that I think maybe, I don't know how many of you are aware of this study, but there are three reasons why I think it should be reconsidered, or at least thought about again in terms of, is it really relevant to the discussion of bioidentical hormone replacement therapy? And we're going to define that in just a minute here. So cogent means that appealing to the intellect or powers of reasoning, because really there's a lot of emotion surrounding this whole field. When you start talking about hormones and menopause and quality of life and cancer, and this could increase your risk of heart attacks and cancer. It's very powerful fear and emotional responses going on, and so much so that you either will or won't do biological hormone replacement based upon some of these numbers. And so, but I want to look at three areas. Number one, the average age of the enrollee in this study, it turns out it was 63. That's the average age, so we'll come back to that in a minute. The hormone replacement therapy that was used in the Women's Health Initiative was Prempro, the full strength dose. Now a lot of doctors are using the half strength dose. And the Prempro was given by the oral route. And these sound like maybe I'm going to be nitpicking here, and they're just three minor variables, but I don't think they're minor. I think they're worth considering. So let's talk about this average age of the enrollee, 63 years old. That means that they were enrolling women who had already been in menopause for maybe 10, 15 years. There's the average age of menopause is what? Somewhere around late 40s to early 50s, some women earlier, some women later, but somewhere around 50 is where women will go through the change. And so these women, a big portion of them, had already been through the change. They had already been without hormones for over 10 to 15 years, maybe 20 years, because this is the average age. So there could have been some 70-year-old women in the study, obviously. So after the first year of treatment, the increased cardiac risk of the people that stayed in the study greatly diminished, the ones that stayed in the study. So really what happened is that maybe there is some risk if you have not been on hormones. I always tell women, if you've not been on any hormones and you're coming to see me and you're 75 years old, I'm not sure if I want to put you on hormones because of this study. This study does show that maybe elderly women who have not been on hormones, maybe you shouldn't go on hormones if you're like 70 or 75, because your body already has the risk of cardiovascular disease, and maybe there is something about Prem-Pro that does increase that particular risk in you. The younger enrollees in the study, 50 to 59, experienced reduced cardiovascular risk. And this we know, most doctors know that women are pretty much have a much lower risk of heart disease before menopause. We know that female hormones are heart protective. Every doctor knows that. After you go through menopause, then you start to kind of like the Virginia Slims, you start to be like men, unfortunately. But in that regard, in terms of cardiovascular risk. But if you've been on hormones right from when you start in, if you go on hormones right at the start of menopause, what you're doing is continuing the protection of your natural hormones. And so this study really did not show that younger enrollees were at higher risk for heart disease, and that might actually help protect them longer. So this suggests that the older enrollees already had emerging cardiovascular disease, and that the hormones did not protect them. Maybe they did something to make them worse, but they certainly didn't protect them. Second issue with the Women's Health Initiative, the use of Prem-Pro as hormone replacement therapy. Prem-Pro is a patented medication made partly from Premarin and partly from Provera. Premarin is a natural substance. It's derived from pregnant horse mare urine. So now we're back to like the Chinese, except we're using horses. And somehow that makes it better, I don't know. Pregnant horses, there you go. And so that's equine estrogen. It has a very long half-life. Actually, a lot of women, I know a lot of women who did fine with Premarin alone for many, many years. And really when you go back, Premarin wasn't quite so implicated in the negative results of this study as was really the Provera. The people who, I remember when this study came out, we had two gynecologic researchers from the University of Connecticut was here for a lecture, and they really said they were sorry that they had used Provera in this study because it's not progesterone. It's a progestin, which is a patented alternative. You fool around a little bit and change the molecule, and then now you've invented a new molecule so you can patent it and sell it as progesterone, but it's really not progesterone. It's a progestin, and it has been known to cause problems with breast cancer. So progestins added to estrogen is a known cause of both animal and in human studies demonstrating increased breast cancer. So in a sense, using that information and giving this particular compound to a large number of women, we could have predicted that there'd be some increase in breast cancer. But the problem is, was it more just was it just the Provera? Was it the Premarin? Was it the combination? We don't really know. But as a result of this, pretty much all hormones were, the big change that I saw is that doctors started saying, I'm going to take you off your hormones. Because there was a medical legal concern that if we leave you on the hormones, and you have a heart attack or you get breast cancer, and I as a doctor have prescribed you Provera or Prem-Pro, then I'm at medical legal risk for having caused knowingly caused your cancer or your heart disease. So that's why a lot of doctors started withdrawing women from these hormones. And I don't remember, I think I was here at the clinic when that all started, so that was not part of that, but it couldn't have been any fun. The disadvantages of the oral route. The third thing about this is that all of these hormones were given orally. And when you give a hormone orally, it goes down into your stomach, it's absorbed through the intestines. The first place it goes is your liver. It's what we call the first pass effect. Hormones going through the liver go through metabolic transformation. And many of the metabolites are not as beneficial as the actual estrogens themselves. And so most of what we now know about bioidentical hormones is we don't give bioidentical hormones orally. We use it transcutaneously. We use oral troches, ways to absorb it through the oral mucosa, vaginal, or some kind of skin route of giving the hormones. So this way we avoid 4 different first pass effects. When you take hormones orally, you increase sex hormone binding globulin. That binds up the hormones that you're taking so you don't get as much use out of them. It increases your number of clotting enzymes, which may have given rise to the higher incidence of heart attacks. It can also give rise to strokes and pulmonary emboli, the embolic phenomena in your legs. It can also increase your risk of gallbladder disease. We know that birth control pills is associated with higher risk of gallbladder disease. And it also can increase your triglyceride levels. And so if you have a high triglycerides and a low HDL, that will increase the wrong size of the particles. The LDL particles are your low density lipoproteins. They're the ones, when they're small and dense, they are the ones that cause heart disease. They're more atherogenic. And so by increasing your triglyceride levels, you increase the number of these LDL particles. So by giving hormones orally, that's not the best way to do it. So what I want to show you is some basic principles of bioidentical therapy that I think help mitigate against these 3, shall we say, concerns that I have about the Women's Health Initiative study that I think set up the study to have a negative result. So orthomolecular principles are standards of care based upon our knowledge of how the human body works, and they reflect some of the insights of Dr. Linus Pauling, who wrote his famous article in the 1968 issue of Science. Orthomolecular. Ortho means right. You go to an orthodontist to correct or make right, your teeth, the crooked teeth. An orthopedic doctor straightens out your bone fractures. So ortho is orthodontics, straighten out the teeth. So ortho means the right or the correct. So there are 4 orthomolecular principles that are employed in bioidentical hormone replacement therapy, which I believe makes it a safer way to go. You're using the right molecules at the right dose, and you're dosing it in the right way, and you're using it under the right professional care. And so let me define each one's a little bit more. So the right molecule. So in bioidentical hormone replacement therapy, we use a compounding pharmacy, and they make the hormones. They make them from either yam or some kind of plant precursor, but it then is chemically converted into the exact same molecular shape as what your body makes. Now, it's not natural in the sense that the only way we could get natural hormones is to do like the Chinese. We'd have to employ large numbers of adolescents to pee for us. Maybe this would solve the unemployment problem that our kids are going through. But we're not doing that. That doesn't jive real well in the modern mind. But we take plant molecules and modify them to be identical to human molecules. And these are the molecules that if you lack them, they create deficiency disease. So we're actually putting something back in that your body normally needs and uses. And we're using it at a dose that is correct to the body. And it's really important that if you are working with a physician who does, or a nurse practitioner that does bioidentical therapy, that they do monitor your levels and they monitor your dosages pretty carefully. I know I'm talking every day to the compounding pharmacies here in town, and the whole science of bioidentical hormone replacement therapy is fine-tuning that dose to that particular man or woman in order to get just exactly the right dose to where they feel well. And you can feel much better on these hormones. Now, if they're not at the right dose, you don't feel better. And so that's the art and science of using these molecules correctly. They help to re-regulate your body again, and women who are on them can tell you, if they're regulated properly, they do feel better. Now, some women don't feel better if they're not regulated properly. This is different than just suppressing symptoms. You know, most medications are toximolecular. A diuretic is basically a molecule that poisons a certain function within your kidney so that you don't reabsorb sodium. That can be great if you're in congestive heart failure and the doctor gives you Lasix and your kidneys now lose a lot of that excess sodium that you've built up in congestive heart failure. That can save your life. So toximolecular, it's not meant to be a slur, but that's how medicines work. They poison functions in order to achieve a greater balance. An orthomolecular molecule works with the body like a nutrient. Hormones, nutrients, these are molecules that naturally occur in the body to help it to do what it normally would like to do. And the right dosing is that you use it in a way that it's physiologically like you would normally receive it if your own organs, your own glands were making it. You use the proper route of entry, as I discussed earlier, oral mucosa or vaginal mucosa or skin. There's various different types of compounds that absorb better at these different places, and different doctors have different preferences, and there's a little bit of an art and science going on with that all the time as well. Optimal metabolic processing and elimination pathways. One of the reasons I like to use, for some women, we're using the vaginal mucosa as an entry site. And that's going right up through the pelvis, much like you would normally be getting hormones if your ovaries were still working. But you can also use troches, that works pretty well. Topical can work well. So there's a lot of different ways that represent right dosing that avoids the first pass liver effect that I mentioned earlier. Finally, the right professional usage. This is important. I think you have to find someone who knows what they're doing, who uses the laboratory, makes the proper selection. You have a good communication link with them. You can call in if things aren't right. You can work with the pharmacy. You can get the adjustment done. And you can monitor these levels so that you're not taking more than what you would normally have, even if your ovaries or your testicles were still working. So the emphasis is on balance of safety with effectiveness for each patient that's seeking this kind of medical care. So I think it does require a knowledgeable practitioner, and the knowledge of the practitioner can make the experience of the practitioner can make a big difference in terms of outcome. And there are more and more doctors and pharmacies around the country that are utilizing this, but I think you do need to check into the credentials and make sure you're getting someone who is certified and effective at making appropriate use. So that brings us finally now to the issue of risk, because that is, after all, the big concern. It's I call it the C word. I mean, you know, people worry about heart attacks. I mean, no woman or man would want to get a heart attack from using hormones, and even though that was, you know, that was one of the big issues, was there was an increased risk of heart attacks and blood clots in the Women's Health Initiative. But really, I think what probably keeps more women or men away from using hormones is their concern about cancer. So in order to discuss this rationally, I wanted to define these different terms. You know, absolute risk, relative risk, and disease detection, which is a whole other topic in and of itself, and then what we can do to reduce risk. So in general, we do find that the risk of breast cancer in women is on the rise in modern times. And this kind of goes back to my discussion early on about all the xenoestrogens, the plastics, the pesticides, the added estrogens in our foods. Certainly this is not good. There are, you know, we have added stress, we have poor quality diets. We have a number of reasons why we think there is an increased risk of breast cancer in women. And same goes for men. There's an increasing diagnosis of prostate cancer. Part of the reasoning is because in the last 20 to 30 years, We do more PSA testing in men, and we do more mammograms in women. And there's a very interesting book that I didn't get to put in the talk here called Overdiagnosed. And the author of this book is a very conventionally minded physician who's really just looking at large population trends and, why are we getting so much diagnosis? Well, part of it is we're screening a lot more than we ever used to. And certainly the possibility of screening errors could be a factor in all of this as well. But nevertheless, that's a whole another lecture that we won't get into right now. But I'm going to just say epigenetic factors, choice factors, that goes back to my original Riordan delta, probably are entering into the rising incidence of cancer in our time. The number one risk factor for either a man developing prostate cancer or a woman developing breast cancer is your age. Age just is and that's when they look at absolute risk, it maps out more or less according to your age. And all you have to do is look at this chart and you can see the older you are, the more likely you are to have, this is breast cancer, I should have put absolute risk of breast cancer. But it's true for men too. As men age, there's a linear rise in the incidence of prostate cancer. And they did a study in Detroit on men where they looked at over 500 deaths where they got the okay of the family to do an autopsy of the prostate of the men that died. And there was almost a linear relationship between your age and the likelihood of finding prostate cancer. So if you were 20, you had about a 10 to 20% chance. If you were 40, 40%, 60, 60%, 80, 80%. So just with age, there's a greater chance that breast cancer or prostate cancer will develop. And so that's the number one risk. And they call it an absolute risk because, again, you can't really change that. But then these relative risks are really kind of interesting to take a look at, where they've looked at experimental groups who were involved in different things to see what their relative risk was. Was there if it's a 1, if it was 1.0, there's no difference between the experimental group and the control group. So the Women's Health Initiative women taking Prempro, their relative risk increased to 1.26. And if you want to know then how that affects your total risk, you just multiply that times the percent in terms of your age category, and that kind of gives you your overall risk. Look at this. People who have greater than 13 years of education, 1.79. Why did I go to college? I mean, medical school. Greater than 14 alcoholic drinks per week. Well, that kind of makes sense. I mean, we know that if you're overdoing alcohol, that there's pretty clear evidence on a number of different cancers that excessive alcohol increases your risk for a number of diseases, including cancer, but also heart disease, liver disease, a bunch of different things. Obviously, if you're overweight, increasing weight increases your relative risk. What about the lefties in the group? That's not fair, but left-handed people have a higher risk of cancer, relative risk. Doesn't mean you're going to get. Now, this isn't just, let's just stop here for a second. These are statistical numbers. And people will ask me, well, doctor, how does that apply to me? And I'll say, well, are you left-handed? And they'll say, well, yes, but does that mean I'm going to get cancer? And I said, well, no, it's just that this is something that was seen in the population, and it may be a statistical fluke. And it also doesn't mean that you may not be, even though it's statistically a little bit higher likelihood population-wise, that doesn't mean you're going to necessarily get it, because statistics are that way. It doesn't tell you which individual is going to be the person that ends up in that statistical group. It's just an observation that you kind of use as you're trying to make your decisions about what to do. I mean, I would say, hey, don't drink more than 14 alcoholic drinks per day. Now, if you're left-handed, I don't think you need to retrain yourself to be right-handed.
14 per day?
Per week, I'm sorry. Don't drink more than 14 per day either. Sorry. Night shift workers. I mean, a lot of times, hey, that may be your livelihood. What are you going to do? And if you can get a job, if you can move to day shift, great. But some people don't have that choice, or they're going to lose their job. Does that mean you go out and shoot yourself? No. You just have to take this into consideration as you look at your risk. And so now here's the most interesting thing. They looked at 39 studies of women on estrogen replacement therapy, and I've got this up in my office, but it's a chart which shows all the range of risks, and when you add those all up, it's only 1.2% increased relative risk, which is really not that much. I mean, remember, 1 is no difference between the control group and the experimental group. So yes, there does appear to be a slight risk of going on hormones. But here's going to be and this is how you do your calculate your overall risk, is that you take your relative risk and multiply it times your absolute risk to see how whatever the characteristic is affects your so-called current risk. I said calculating relative risk. It's calculating your current risk. But there's a lot of other things that can this is that book that I mentioned, Overdiagnosed, Making People Sick in Pursuit of Health, Dr. Gilbert Welch. He has some very interesting things on population studies on how, because of the fact that we're screening more and more and more on so many things, we're finding a lot of things, but that doesn't mean that we're necessarily, if you find cancer early, it doesn't mean that you've necessarily done a good thing for the patient. We used to think that was the sine qua non. Find it early and eliminate it, and you're better off. And now they've got enough information that may not be the whole story. So there's no way to totally escape the risk of breast cancer or prostate cancer, because, if we're going to age, we're going to have that risk. There's no such thing as absolute safety. But I was thinking this morning about this lecture, and I was thinking about how many of you drove here today? Did you know there was a risk of having a car accident? But you went ahead and got in your car anyway and drove here. Why? How many of you consider yourselves defensive drivers? You take care to mitigate those risks by looking both ways and putting on your seatbelt, and you're careful about those risks. You could have still, statistically, you could have still had a wreck, and wrecks do happen, and cancer does happen. But the beauty of the health orientation approach is that we're always trying to make choices that reduce our risk for disease and increase our risk for health. That to me is the most exciting kind of shift in paradigm thinking that I believe is going on right now, is that people are starting to ask themselves not what's going to increase my risk for disease. I'm having people start to think, what's going to increase my risk for health? And what can I do to take better care of myself to increase my risk for health? And I think the bioidentical hormone approach is that paradigm. Yes, you are introducing some estrogen into your body when you do bioidentical hormones, thinking of like women who want to use bioidentical hormones for menopause. And maybe that is a 1.2% increase in relative risk. But what are you gaining? Better heart health, better bone health, better vaginal health, less likelihood of having urinary incontinence, less likelihood of having macular degeneration and Alzheimer's. So again, I think you have to kind of think holistically as you approach this question of, should I use bioidentical hormones? Yeah, you might be taking a little bit extra risk in the same way you take a little extra risk every time you get in your car, but look what your car allows you to do. Who wants to give up their car because they have a risk of having a heart attack or having an accident? So that's my point.